Good morning to all of you, and welcome back to our virtual channel, which will be discussing all about care of surgical patients. So, as nursing assistant, we have a very important role in taking care of patients with surgical concerns. So, let's take a look. What are the things we can assist in doing this type of care. So before we start, let us define some terms that will be useful for us to understand the care of patients or surgical patients. So what is perioperative period? So perioperative period composed of three stages. We have the preoperative care, we have the intraoperative care, and lastly, we have the postoperative care. So let's start with preoperative care. So when we're talking about preoperative care, it is a care given before the surgery. That's why we are calling it preoperative. Pre means before. So it is a care that is given before surgery. Okay, it can be physical or psychological preparations that are made for the operation according to the individual needs or the patient's needs. So we have a lot of things we can do in preoperative care. We have to prepare the patient. First and foremost, we need to prepare their emotional condition. Also, we need to prepare their physical condition as well. So, for emotional preparation, we can help the nurses or the doctors to uh, make the patient aware of what they are going to have, what are the things that they will undergo, what are the things that they need to expect during the operation. So, in this way, the patient will not be anxious or stressed. Next one is physical preparation. Physical preparation, we are telling to the patient that you are on NPO status. So what do we mean by NPO status? As we remember our topic in medical abbreviation, okay, NPO status means nothing per RM. It means nothing or no food or fluids to be taken by mouth. So it is a very important preparation for the patient so the patient will not aspirate if they will give anesthesia. So NPO, we should always tell the patient before the operation at 12 midnight, you're not allowed to eat or drink anything. So next is test and blood works. Any patients that they are undergoing any procedure or surgeries, they should have first test and blood works. So we should help them, for example, lipid profile. What is lipid profile or cholesterol? This test needs to have a fasting. So we can help the nurses to tell the patient that you are fasting for today because we need to check for your blood test because it is very important uh, basis for us to do for us to do the surgery. So this is the importance of tests and blood works. So we cannot pursue the surgery if the blood works are all abnormal. So it needs to be normal, or else if there is abnormality in their blood tests or blood works, the doctor will refer the patient to the concerned doctor. For example, if your patient is having high blood pressure or high cholesterol, high uric acid, high sugar, okay, the patient should be referred to the medical doctor. So the medical doctor will order medications, okay, or medications for the preparation of the surgery. The patient who is having NPO, who will be having NPO, should have an insulin infusion, okay, because he has nothing, all of this blood sugar will go up, okay, because of the anxiety, because this is the defense mechanism of your body. So the medical doctor will order for insulin. Next is surgical consent. No surgery can push through if there's no surgical consent. Surgical consent is very important for the patients because this is the sign that the patient understood the procedure. Without this, the patient will not undergo the procedure. Make sure that the surgical consent is taken by the doctor who will be doing the surgery. Otherwise, if there's no surgical consent, it will be a big problem. No surgery will happen. Next is morning of surgery. During the morning of surgery, for example, tomorrow is the surgery. So tomorrow morning, the patient should be prepared well. So first, if the patient is having abdominal operation related to gastrointestinal tract, for example, appendicitis, or the patient will be having colonoscopy or sigmoidoscopy, the patient should have an enema. So I told you last Friday, I taught you how to do enema. So why we need to do this enema and vaginal preparation? It's because we need to clean the bowel of the patient. We need to clean the vagina of the patient so that the operative site will not be contaminated with any stool or any vaginal discharge. Next, bathing. Bathing is very important for us to make sure that the infection control, that is one of the infection control protocols, so the patient skin will be clean. Next is grooming. Grooming should be, we will change the patient's gown. It should be the operative gown. Okay, we cannot give the patient what they call this, pajama or whatsoever. The patient should have a gown. So it's very easy for the operation or the nurses in the operating room to do whatever they need to do for the patient. And also oral care is very important, okay, during the morning of surgery. Okay, you tell the patient that to go for an oral care if he can, or you can assist the patient for oral care. So the patient will be comfortable and will be groomed well. Next is dressing. Dressing is very important as well, like changing of gowns or the appropriate dress for the patient. So these are the preparations during the morning of the surgery. We have also preoperative teachings. What are those preoperative teachings that we can offer to the patient? First, of course, is the NPO. We should tell the patient that it's very important to follow the NPO diet because no surgery will be pushed through if he will not be NPO. The patient who will not follow you for the NPO will not have surgery because the patient should fast for at least 8 hours so the patient can have the surgery. What else is the preoperative teachings that we can offer as nursing assistant? We can offer also, we can tell the patient that if he understood the procedure, okay, if he signed the consent, he should understood the procedure. If he has any doubt about the procedure, he should ask the doctor beforehand. Also, we can tell the patient about the grooming and bathing, okay? Before the surgery, you should be clean, okay, to prevent any infections. And of course, before the operation, the patient will be anxious, okay? No person will not feel anxious if if the doctor will cut your body. So it is normal that the patient will be anxious. So as a healthcare provider, we can help them to do deep breathing exercises, to tell them if you are anxious, you can do deep breathing exercises. It will help a lot. And also, we can tell the patient also before the surgery, what are the things that they will expect. Okay, what are the complications of surgery? Okay, and how you will prevent those complications. So in that way, the patient, you will preempt the patient what are the things that we will expect. Next is preoperative checklist. Okay, during operation or during preoperative period, we are giving we are having a checklist. What are the things we are going to accomplish before the operation, and we should follow that so to have a better outcome of the operation. Okay, so that is the first phase of perioperative period. The second phase is the intraoperative care. So intraoperative care is during the operation itself and the ancillary to that operation. So in this time, only the surgical team, the doctor and the circulating nurse and the scrub nurse is the one who is taking care of the patient. So if you are taking care of the patient in the ward and you shift the patient in the operating room, okay, the one who's taking care of the patient at that time during the operation is the scrub nurse, the circulating nurse, and the doctors, and the other nursing assistant who is assigned in the intraoperative area. Lastly, we have the post-operative care. So if we're talking about post-operative care, it means after operation. So what are the things we're going to do? First, we should prevent the complications. Operations has a lot of complications. If we are signing a surgical consent, okay, it's written there that any complications happen to the patient, the hospital or the doctor is not liable for that complications or any side effects. As long as you understood the procedure, okay, you sign it, okay, the hospital and the doctors has no liabilities for you. So to prevent these complications as nursing assistant, we can help them. Like in respiratory, we can prevent atelectasis. What is atelectasis? Atelectasis is the number one complication of operation. Atelectasis means lung collapse. Because the patient will have an anesthesia, the tendency is the lungs will collapse, okay, because of the anesthesia. Usually the lungs will always expand, okay? But during anesthesia, it will sleep your lungs. So the tendency is you will have difficulty breathing or you will have pneumonia and other respiratory problems. So what are the things we can offer to the patient? We can offer them this coughing and deep breathing exercises. So you tell the patient, just put a pillow on their abdomen, okay, and cough. In this way, you are helping the lungs to re-expand again. And also, deep breathing exercise is very important. Deep breathing exercise will help the patient to re-expand the lungs as well. And I told you one other device like incentive spirometer, okay, can help the patient to re-expand the lungs. Okay, you just offer the patient, especially the patient had taken general anesthesia. General anesthesia means it will anesthetize your whole body. Okay, they will just inject on your IV the anesthesia itself, and you'll become groggy or you will sleep. Okay, so to regain your normal functioning and to remove the anesthesia from your body, you need to have this incentive spirometry. Incentive spirometry, very important function is to re-expand your lungs again. Okay, so I told you how to use the incentive spirometry. You just use the mouthpiece and then you just inhale and then you just exhale, and then make sure at first you will not uh, elevate the ball inside the spirometer, but when time comes, it will, when your lungs is expanding, it will go up. So this is one complication. Next is sequential compression device. Some patient, they are putting like stockings for the patient, stockings, anti-embolic stockings like that. Or they are putting a machine to squeeze the legs of the patient. On this way, they are preventing the condition which we are calling it as pulmonary embolism. What is pulmonary embolism? Pulmonary embolism, because you are lying long time on the bed, okay, you are bedridden. I mean, you are on bed rest because you had the surgery. The tendency of your body is they will develop a clot, okay, in a certain part of your blood vessels. And if that blood vessels, okay, that clot, okay, will move into your lungs. And if it will move to your lungs, you will develop a pulmonary embolism. What you will feel, you will have a tachycardia, you'll have difficulty breathing. So to prevent this, they will put you a compression device, a device which is applied on your legs. Okay, so your legs will not develop a clot, okay, which further develop into pulmonary embolism. So that is sequential compression device. We have also anti-embolic stockings, okay, or TED. Anti-embolic stockings is like a stockings, but it is with size, okay, it depends upon the size of the patient. And it will help you to prevent also pulmonary embolism. Leg exercises is very valuable also. Leg exercises will help you also to prevent this complications, pulmonary embolism. So just assist your patient to dorsiflex and plantar flex the foot. We can assist also during post-operative period. We can assist the patient in their positioning. Okay, it depends upon what they did to your patient. For example, the patient received spinal anesthesia, okay? The patient had operation on the fracture of the leg, but the patient only received spinal anesthesia. We should instruct the patient that he should maintain a flat, he should maintain flat position for 24 hours to prevent spinal headache. Okay, spinal headache, it will happen if you will elevate your head. Okay, so the position for this one, okay, is only flat on bed, no pillow. It should be flat on bed for 24 hours. We should position also, we have also condition that positioning is very important. Like for those patients who receive general anesthesia, we cannot let the patient sit or stand immediately after the operation because the patient might collapse. Okay, just wait for 4 to 6 hours before the patient will regain consciousness, because the patient might fall if the patient will collapse. Next, we have also other operation like hip surgery. Okay, during hip surgery, after hip surgery, they will. You should remember that the patient's hip should be abducted. Should be adducted. So, adductor pillow is very important. You should put an adductor pillow to the patient because you will lose the uh, to maintain the 90-degree angle of the hip. If you will not do this, what will happen to the operative site? Okay, it will broke the bone again, or it will not maintain the immobilization that the doctor put on the immobilization screws and pins that they put on the hips of the patient. Assisting with nutrition. We can assist also with the nutrition of the patient. For example, for those patients who receive general anesthesia, okay, operation which use general anesthesia, we should instruct the patient that he should be still NPO for 4 to 6 hours after operation. Why? Because the patient might vomit. This is the side effect of general anesthesia. If your patient had spinal anesthesia, you will instruct the patient to take more fluids. Okay, after operation, he can drink as long as he can take liquids or food as long as he has consciousness. But you should encourage the patient to take more fluids. Why? Because the spinal anesthesia will numb or decrease the function of your bladder. So you will have difficulty urinating or voiding. So you will have what do you call this? Urinary retention. And if you have urinary retention because of spinal anesthesia, what they will do straight catheterization for you. And there are some operations that needs that you cannot eat immediately regular diet, like appendicitis. Okay, if you have appendectomy, okay, you cannot eat immediately regular food. You should start with NPO diet, then clear liquid diet, then full liquid diet, then soft diet, and then regular diet. So you should progress to different kinds of diet before you will be on regular diet, because what will happen, your gastrointestinal tract is disturbed. So if you eat immediately regular diet, okay, it will be more disturbed. So you should take food slowly by slowly. Assisting with elimination. During elimination also, you can assist as nursing assistant. You can also assist in their elimination. How? For those patients who has received general anesthesia, for example, they cannot go to washroom. They should be on bed rest for 4 to 6 hours. So you should assist on their elimination needs. If they want to void, you give them urinal. If they are male, if they are female, you give them bedpan. So these are the things you can do during for their elimination. Next is assisting with hygiene. After operation, the patient had 8 hours, nothing per RM, or the patient is on NPO. So if you will notice their breath is foul odor, or they have this dryness on their mouth, so you should assist on their oral care. Next one is assisting with walking. For those patients who had operation, at first mobilization after operation, you should assist them. Why? Because some patients, their first mobilization after the operation, some patient they will fall down. Some patient they will collapse because of the anesthesia that they received. So you should be assisting in their walking. So this is the end of our care of surgical patients. So next topic is taking care of patients, pediatrics, infant, toddler, and also adult. And last is the taking care of patients or geriatric patients. Thank you. If you have any questions, just raise your questions in our WhatsApp group. Thank you.